Alright, so I'm now going to continue with learned paralysis in chapter 3. Um, 1984, a man named Philip was in an auto accident. Um, and the result of this, Philip had his nerves to his left arm pretty much yanked off his spinal column, so his left arm was left completely paralyzed. Um, with, After this happened, Philip continued to have the arm. He left it at his side in a fixed point in a cast in a sling. But after a year, the doctors wanted to amputate it because he had a constant pain in the paralyzed arm, and it was believed that if they chopped it off, the pain would cease. So, Dr. Ramachandran was doing a study on phantom limbs and asked patients to come in, and he got this man to come in, and basically Ramachandra had created a virtual reality box or mirror box, being able to help the patient. We need to go a little bit more into the learned paralysis itself. Basically, the definition is it's a phantom limb that is in a fixed position and cannot move. A lot of patients describe it as being like trapped in a block of ice, just stuck there. It is thought, but not exactly known, that learned paralysis is stamped into the brain circuitry within the motor centers, and partially in the parietal regions concerned with the body image. Um, so the virtual reality box is used in order to attempt to reverse learned paralysis through giving visual feedback. This works because the client sends motor commands to both arms to make symmetrical movements. The client then sees a reflection in the mirror and the phantom hand moving. This sends visual feedback and can restore voluntary control of the paralyzed phantom limb. So in the case itself, Dr. Ramachandran had the patient place his right arm and the left arm with the paralyzed phantom limb, or the left amputated arm, rather, in the virtual reality box. So the patient actually saw when his right hand opened and he was attempting to move his left hand in the same motion. He saw the left hand moving. This gave a visual feedback to mind, and as a result, he was able to open his left phantom hand and move it so it sees the pain. So this was kind of astonishing. Ramachandran wanted to see, how much further this could go. So he gave the patient the virtual reality box or mirror box and asked him to take it home. So after 1 week, Ramachandran checked up on him. He said that nothing really had changed much outside of the physical pain being gone and the phantom feeling as if they were unparalyzed for a big portion of the day, and then he would have to do it again because it would stay paralyzed. So after 4 weeks, the man checked in again, and something astonishing happened. Basically, the guy's arm, the whole phantom arm that was left, was, well, disappeared, except for the palm and the fingers. And the result, well, yeah. And this might have occurred, basically the phantom palm and the fingers being left over because of the pen-filled map itself. Within the pen-filled map, these portions of the body are actually bigger because there are so many intricate movements we do with our hands or fingers. So basically, I feel as if it would take a lot more time to actually resolve or cause the phantom hand to disappear. If you continually work with it over time in the mirror box, maybe more hours a day over a longer period of time, the pen-filled map might be able to remap entirely, and eventually the visual feedback, or it would, trick the brain into thinking it was there, and it would kind of have to come to a visual reality concept where it would just give up and cause the phantom palm and the phantom fingers to disappear as well. And I'm going to stop right here and upload another video because I'm having technical difficulties. I've had to release 3 times now because of the YouTube video. So I'm going to stop there and then I'll pick up with banking pain.